Thank you, Emily. That was lovely to hear from you. Next, we have Andrea Russell, who is a registered nurse with over 30 years of experience in diverse healthcare leadership roles. Her interests include safety and quality in healthcare, including nursing research. She is currently researching consumer choice and risk enablement in falls prevention within residential... Sorry, I've lost... within residential aged care as a part of her PhD, and works as the Director of Clinical Services in a small rural health service. Welcome, Andrea.
Hello, so as you heard, I work in Great Ocean Road Health, which is a small rural health service with campuses in Apollo Bay and Lorne, so I feel very fortunate to work there. I'm also doing a PhD in examining consumer choice and risk enablement in falls prevention within aged care. So I've got 5 minutes, so it's going to be a very brief overview. So imagine that you're told that you can no longer walk to the bathroom by yourself. Not because you can't, because somebody else has decided it's safer if you don't. This is a common experience for people living in aged care. Falls are common and have serious consequences, including injury, hospitalisation and death. So aged care focuses heavily on preventing falls. This focus on safety can come at a cost to independence, dignity and choice. So my research has been examining perspectives of family carers, people living in aged care and the workforce. Within aged care in Australia, there's a statement of rights, which includes the right to autonomy and choice. And we know that autonomy is really important for quality of life. However, maintaining independence and enabling risk can be really scary for the aged care workforce, who feel a responsibility for keeping people safe. So looking at how decisions are made in falls prevention was the main focus of my research. I've combined responses from family members, the aged care residents and the workforce, looked at decision-making preferences, organisational guidance and care records to look at how risk is and choice is balanced in real life. So I used a tool called the Control Preference Scale to examine how aged care residents wanted to be involved in decision-making on falls prevention. So there's 3 categories, active, passive and collaborative. Participants in this study mostly wanted to have an active or collaborative approach to be involved in decision-making on falls prevention. From the qualitative aspect, residents told me they valued their independence. They wanted to be able to walk to the toilet, make decisions around daily activities and mobility, even if it involved a risk of fall. They often talked about falls and downplayed the seriousness of falls that they'd experienced, even though they were quite traumatic to hear. This may be because they're trying to reduce the feeling of feeling vulnerable and the fear of losing independence. So we continue to have an environment within aged care where the focus is very much on falls prevention, which is understandable when 1/3 of residents will fall. We've also got the national quality indicators where we have to report falls rates and serious injuries from falls. These indicators contribute to measures for our star ratings for each facility. Additionally, we have to report falls to this Aged Care Quality Commission. So this creates a tension, not because people are doing the wrong thing, but because the system prioritises safety. So perhaps there needs to be a shift in thinking around falls prevention in aged care. Not about restricting movement and choice, but supporting informed choice and decision making, and enabling the workforce to have the tools to truly feel confident to enable risk. Because person-centred care is not about eliminating all risk, it's enabling people to live the life that they would choose.
Thank you so much. Next we have Paul Wembridge, who will be talking to us about a standardized Residential Aged Care Falls Prevention Audit Tool. Welcome, Paul.
Hi everyone, thank you very much for inviting me along today. I'm going to continue the theme actually. I thought I might have been the only rural person, but it seems we've got rural and aged care all bound up together. Before I start though, I'd really like to acknowledge this is very much a collaborative piece of work. I'm from Hayward Rural Health, but this work's also been done with Western District Health Service and Portland District Health. And we've got quite a large diverse project team which is listed there. So the issue and where we started at with this work. So as some of the previous speakers mentioned, we know that in any 3-month period, about 1 in 3 Australians who are in residential aged care will have at least one fall. It could be more than one. And this has had a lot of attention, so it's been in the media a lot. So we've had an aged care commission a few years back. We've had new guidelines come out, specific guidelines as well for aged care as well. We have things such as awareness campaigns, Falls Awareness Months, seminars like this. We have, as some of the previous speakers mentioned, we have a lot of reporting in aged care, an awful lot of reporting, and that includes things such as falls as part of the QI program or Quality Indicator program. But despite all this attention that it's got, the actual number of residents who fall hasn't changed in years. It's been stubborn, it's just sat at that 30-ish% without change. So are we actually getting somewhere with this work? So despite all of this stuff that I've been talking about, we haven't seen a change. And one of the reasons we thought was that a lot of these interventions, they really focus on intervening after somebody has already fallen. So for example, the Quality Indicator program focus on measuring once the fall happens. But we were looking at that and thinking, well, why should we wait for the fall to happen? We should be intervening when we know these people are at risk. We shouldn't be waiting to see that they fall. And now let's go and do all this stuff. So can't we do it a bit earlier? Some other stuff that's out there as well, like Safer Care Victoria have done some work in this space and they do have some fall review tools, but there is, with some small exceptions, most of this again focuses on reviewing somebody once they fall and not looking at what we can do to prevent it. So is there an opportunity? I come from Quality and Risk sort of land, but it was a very multidisciplinary team. Is there an opportunity that we could introduce some sort of audit tool here that we could actually look at the falls prevention strategies we know will reduce the risk before somebody falls? And could we go a step further and maybe make this standardised so we could look across different aged care providers so that, one, we could identify areas for improvement at our own service, but then we could also see who is doing particularly well in that area and we could go and ask them for help. So what did we do? So we set out with a project very, very loosely based on the Model for Improvement methodology, with the aim is to assist in identification and monitoring of improvement opportunities. This activity aims to introduce an evidence-based regional residential aged care falls prevention audit tool to 3 aged care providers and to have completed audits of 50 residents by 30th of May. So as you see with the date, this is hot off the press and by no means finished. It's something we're still working on. So the context is the 3 rural aged care homes located around southwest Victoria. We've got a multidisciplinary team, and as you can see there, we're into our 6th PDSA cycle, which we're just about to complete from there. We started small with simulations and then slowly moved up to multiple residents, multiple facilities, and we transitioned from paper eventually to an electronic tool. So what does the audit tool look like as of today? So essentially we started off with subject matter experts, physiotherapists and nurses, taking the prevention of falls and harm from falls in older people guidelines from the Commission and taking out key parts that we thought were not only important but something that could also be very easily audited and very objective, so when we come to that benchmarking it's actually valuable. We ended up with 6 parts to the audit tool, so the first being some basic details on the resident, the second part being about the falls risk assessment. The third part was falls prevention care plan. Part 4 was all about the mobility aids, and part 5 environmental hazards and the room layout. And the final was just a spot for anyone who's doing the audit who may have made improvements there and then due to some risk they'd observed as part of the audit. As for how we did it, you can see there's a little video playing on the side there. We started out with paper, but we've now transitioned that to RedCap from there. On completion, it does summarise the findings and send it back to the person who did the audit. So then the local aged care provider can, if they have their own internal policies about documentation or recording, they can then put that in the medical record, or the aged care record, I should say, of the resident. So that's where we're up to. So next steps Our testing is sort of coming to completion. We're getting very little feedback, which to us sort of says we're probably getting it pretty close and ready to go. So now we're looking at more around the steps around implementation. So if we roll this out, we need to do things such as put in place local policies, work out how many residents, how frequently we're going to audit them, how we're going to report that data back, how we're going to share it, can we benchmark, and how would we visualise that and share with the teams from there. We also need to work out some practicalities, like if we do want to do benchmarking, we're going to need some sort of data sharing agreement, so that's sort of we're just starting to explore that now. And of course, we're only 3 aged care homes at this stage, but the more the better. So if you're interested in joining us, that's my email there, QR code and references. So yeah, thank you.
Thank you very much for those presentations. It's always good to hear of initiatives on the ground. I really enjoyed hearing what you're doing and the efforts that you're making in